Snack foods like chips, pretzels, and crackers are among the most underestimated dangers for people with high blood pressure, largely because they seem small, light, and harmless. A bag of chips or a handful of pretzels doesn't look like much compared to a full meal, and crackers are often marketed as light snacks or even healthy when paired with cheese or hummus. But these foods are anything but innocent. They are stealthy sodium bombs, often delivering large amounts of salt in small serving sizes, and because people rarely eat just a few pieces, the sodium load multiplies quickly, causing real harm to anyone with hypertension. The biggest danger is that snack foods are deceptively concentrated sources of sodium. A single ounce of potato chips, barely a handful, contains 150 to 200 milligrams of sodium. A modest portion of pretzels can contain 400 milligrams or more. Crackers are no better. Even plain salted varieties often contain 150 milligrams per serving, and flavored or cheesy ones can go much higher. But serving sizes on labels are notoriously misleading. Few people stop at 1 ounce or the recommended handful. Instead, snack foods are designed to be addictive, leading to consumption of 2, 3, or even 4 times the stated portion. That means a casual snacking session in front of the television can easily deliver over 1,000 milligrams of sodium without a person realizing it, nearly an entire day's worth for someone with high blood pressure. The sodium, of course, causes water retention, expanding blood volume and directly raising blood pressure. But the real danger is that snack foods aren't usually eaten in isolation. They are often paired with other high-sodium foods, like sandwiches, cheese, deli meats, or fast food, stacking the sodium load on top of already unhealthy meals. This compounding effect means snack foods act like accelerants for hypertension, pushing blood pressure higher and higher while the arteries, heart, and kidneys bear the brunt of the strain. It's not just a snack, it's another layer of stress on an already overworked cardiovascular system. The risks don't stop with sodium. Chips and many crackers are fried or baked with unhealthy oils that add saturated fats and, in some cases, trans fats, which damage arteries, promote plaque buildup, and worsen the long-term progression of hypertension-related complications. Pretzels, though lower in fat, are refined carbohydrate bombs. The simple starches are quickly broken down into sugar, causing blood sugar spikes and insulin surges, which fuel inflammation, weight gain, and eventually metabolic syndrome, all of which increase the likelihood of developing or worsening high blood pressure. This means that snack foods attack the cardiovascular system from multiple angles at once. Sodium spikes blood pressure acutely, while fats and refined carbs accelerate the underlying conditions that make hypertension more dangerous and difficult to control. Another insidious aspect is the psychology of snacking. Because chips, pretzels, and crackers are considered extras rather than meals, people underestimate their impact. They eat them mindlessly while working, watching TV, or socializing, consuming far more than they realize. The marketing around these foods often reinforces the illusion of safety. Labels like baked, light, or whole grain may trick consumers into thinking the food is healthy, when in reality the sodium content is unchanged or even higher. This makes snack foods particularly dangerous. They don't feel like a threat, but for someone with hypertension, they silently pile sodium into the bloodstream day after day. The long-term consequences are alarming. Regular snacking on salty, processed foods contributes to chronic hypertension, kidney strain, fluid retention, and arterial stiffness. The heart is forced to work harder against elevated pressure, increasing the risk of left ventricular hypertrophy and eventual heart failure. Meanwhile, the kidneys, constantly filtering excess sodium, gradually lose efficiency, creating a vicious cycle where hypertension worsens kidney damage, which in turn worsens hypertension. Over years, this seemingly innocent habit of daily chips or crackers can translate into a significantly higher risk of stroke, heart attack, and chronic kidney disease. The most dangerous thing about chips, pretzels, and crackers is how easy they are to overlook. They don't feel indulgent like a fast food burger or a fried meal. They feel casual, something small to nibble on. Yet these small nibbles add up to one of the most significant hidden sodium sources in modern diets. For people with high blood pressure, this casual approach is precisely what makes them deadly. They sneak in through the side door, loading the body with salt until blood pressure is consistently elevated, all while the person feels like they are just snacking. For those with hypertension, the safest strategy is strict vigilance and avoidance. If snacking is necessary, unsalted nuts, fresh fruit, or cut vegetables are far safer choices. Processed snack foods should be recognized not as harmless bites, but as real contributors to dangerous sodium overload. Every handful of chips is another turn of the screw on your arteries, another unnecessary burden on your heart, and another step closer to serious cardiovascular consequences. What feels like a quick pleasure is, for someone with high blood pressure, a very costly risk disguised as a snack.